Alright, so welcome to 92.7 Big FM. शुरुआत करने से पहले I would want कि आप अपना एक इंट्रोडक्शन शेयर कर दें हमारे लिसनर्स के लिए.
मेरा नाम रोचन पंत है, मैं एक डॉक्टर हूँ एंड आई एम एन इंटरवेंशनल रेडियोलॉजिस्ट. तो हम लोग अल्ट्रासाउंड या एक्सरे को इस्तेमाल करके कई चीजों का इलाज करते हैं. And one of the big things we do is we treat vascular disease, which includes diseases of arteries and veins throughout the body. This is what I do. And I have about 25 to 30 years of experience doing these things. So this is what you can say, it's been my life's work to do this.
All right, sir, that's amazing. So we have Dr. Roshan Pant with us on 92.7 Big FM. So sir, शुरुआत ऐसे करते हैं कि सर अगर मैं आपसे पूछूं कि what is varicose veins treatment exactly, क्या होता है? So how will you explain this?
So varicose veins actually ये एक बहुत peculiarly human problem है, यानी कि जानवरों में बीमारी होती नहीं है, सिर्फ इंसानों में होती है. और this can be a very mild problem or a very serious problem. It can be uncomfortable, but it can also be very dangerous because it can lead to wounds which don't heal. Now, varicose veins, if I can explain very simply, it is basically because the veins are there to carry blood from the legs, say, to our heart, right? And in the human beings, because we walk on two legs, the heart is a little above your legs. So it is like pumping water to the roof, right? I think that's pretty simple. So you need a pump, you need a pipe, and the pump is the muscles in your leg. We call it the calf pump. ये पैरों की जो मांसपेशियां हैं वो जब चलता है पैर, जब आप चलते हैं तो वो दबाती हैं नसों को, and the blood gets pumped up. But at the same time, you can pump the blood up, but if you don't shut the valve, the blood will come back down because of gravity. तो जब ऐसा होता है, जब ये valve खराब हो जाते हैं, तो the blood does not get out of the leg properly, and that causes varicose veins, which are basically swollen veins that we can see under the skin. They are called varicose veins. This is what it is.
Okay. So when we talk about this varicose veins, so इसके जो options होते हैं patients के लिए different होते हैं या उनको choose करना पड़ता है?
तो ऐसा है कि आजकल के जमाने में most varicose vein treatment has changed a lot. पहले क्या था, हम सर्जरी करते थे, यानी कि जो भी वेन जिसका वाल्व खराब हो गया वो वेन हम बेसिकली हमको बंद करनी होती है. तो पहले क्या करते थे, we used to do something called stripping. So stripping involved cutting open to the vein at the top near the groin and then basically tying it off there. और उसके बाद वेन के रास्ते एक पतला सा तार डाल के उस वेन को पूरा खींच के बाहर निकालना पड़ता था, क्योंकि उस वेन में कई सारे कनेक्शंस होते हैं. So just tying the vein doesn't work. So they had to strip it, which was, well, as you can imagine, it was painful. It could cause bleeding, swelling, bruising, and it required a reasonable amount of recovery period. एक दो हफ्ते तक, you had to keep wearing dressings, bandages, all that stuff was there. But then new options came up, which changed the field of varicose vein treatment. And these options are what we call minimally invasive. मतलब एक छोटे से छेद से, like a pinhole. I mean, we talk about keyhole. This is like a pinhole surgery. We go in through a pinhole, block the vein from the inside. So there are a few options which have to be chosen depending on the problem and the vein involved. 5-6 options are there. One of them, for example, is a simple one called sclerotherapy. तो ये बहुत simple चीज है. It's basically a chemical treatment. इसमें क्या करते हैं, वेन के अंदर एक सुई डालते हैं, एक स्पेशल केमिकल उसमें डालते हैं, और वो केमिकल अंदर से वेन के जो लाइनिंग होती है उसको एक तरह से जला देता है केमिकली, और वो वेन बंद हो जाती है. प्रॉब्लम क्या है, ये ज्यादा बड़ी वेन के लिए काम नहीं करता ठीक से, बिकॉज वो केमिकल डाइल्यूट हो जाता है खून से. सो व्हाट केम नेक्स्ट वाज दैट वी वेंट इनटू द वेन एंड वी स्टार्टेड हीटिंग द वेन फ्रॉम इनसाइड यूजिंग लेजर. लेजर से वी हीट द वेन फ्रॉम इनसाइड एंड दैट बर्न्स द वेन, एंड दैट वेन गेट्स परमानेंटली ब्लॉक्ड इफ यू डन इट करेक्टली. दिस इन्वॉल्व्स द यूज ऑफ समथिंग कॉल्ड ट्यूमेसेंट एनेस्थीसिया. क्या है कि लेजर का रेंज जो है छोटा होता है, तो वेन को बिल्कुल लेजर के सोर्स के नजदीक लाना पड़ता है. तो हम वेन के चारों तरफ सेलाइन या लोकल एनेस्थीसिया डालते हैं, जिससे वेन दब जाती है प्रोब के चारों तरफ. उसके बाद उसको अंदर से जलाते हैं, एंड दैट कॉजेस द वेन टू ब्लॉक परमानेंटली. राइट. The same thing can be done by something called RF, which is radio frequency, heating the vein from inside, and this is a little less painful than laser, but again requires you to use tumescent anesthesia. So these two were things which came up, say, about 20 years ago, We developed these treatments and we have been doing this over many years.
Hmm.
But then now we also have an option of what we call adhesive treatment, यानी glue.
Right.
मतलब कि आप वेन को बंद करना चाहते हैं तो उसको गर्म कर रहे हैं अंदर से, उसकी जगह हम अगर सिर्फ उसको चिपका दें by using a special medical adhesive glue that we inject into the vein. So that is very simple. You use ultrasound. वेन के अंदर आप जाते हैं, नीचे से जहां तक वेन खुली है वहां तक, उससे लेके ऊपर तक जाते हैं एक पतला सा ट्यूब, one very small fine catheter we call it, we put it inside, see it under ultrasound. Then we inject glue inside the vein and press it so that it gets shut permanently, and this is like a super glue.
Okay.
Like वो फेविक्विक का ऐड देखा होगा आपने ना, चिपक जाती है उंगलियां, उस तरह से वो ग्लू से बिल्कुल चिपक जाता है. And this has very good success rate, and the best part is it is relatively pain free for the patient. Because there's just one place where we inject local anesthesia to go into the vein. Apart from that, the procedure is not painful. The patient can come in, get the procedure and walk off immediately.
Okay.
So same day discharge. ये सब minimally invasive treatment के ये बहुत बड़ा advantage है कि हम उसी दिन patient को घर भेज सकते हैं.
Okay.
And there is no general anesthesia required. The patient बेहोश नहीं करते हैं हम patient को. दर्द ज्यादा नहीं होता है ना. मेरे पेशेंट कभी कभी बीच में सो जाते हैं तो उनको जगाना पड़ता है कि भैया ट्रीटमेंट हो गया, अभी उठ के घर जाना पड़ेगा.
Okay.
So this is very, very convenient, and I've been doing this for many years now, and it's really changed how we look at these procedures. Patients are very comfortable with this.
Okay, so I was going to ask you the same question, but आपने खुद ही explain कर दिया इतने easily. This is like not at all painful, and so I'm sure कि there must be a lot of patients जिनको ये होगा, प्रॉब्लम होगा कहीं ना कहीं. they must be scared about this. So ऐसा कोई मैसेज है जो आप हमारे लिसनर्स को कन्वे करना चाहेंगे for like for varicose veins?
हाँ, तो इसमें दो तीन few things are very important. One, it is a very common human problem, and sometimes ये बहुत मामूली सा भी हो सकता है, माइल्ड भी हो सकता है, और जरूरी नहीं कि हर केस में हम ऑपरेशन करें, लेकिन उसको चेकअप करना जरूरी है, क्योंकि ये प्रॉब्लम जब बढ़ता है और ये बहुत धीरे धीरे बढ़ता है, इट इज इंसिडियस, इट इज स्लो, तो धीरे धीरे बढ़ते बढ़ते एक ऐसी पॉइंट पे पहुंचता है जब काफी तकलीफ होती है पेशेंट को, और द पेशेंट डेवलप स्किन चेंजेस, blackening of skin, thickening of skin, severe itching, and worst is when they get bleeding or they get wounds which don't heal. Those wounds can take months to heal. So it's better if somebody has varicose veins to get checked up and see whether anything is required or not than to keep waiting and not knowing. It's better to see a professional. The other part is what you can do about varicose veins. The most important thing is varicose veins तो होती हैं partly genetic, तो जिसको होती है उसको होती हैं, बट जो लोग अनफिट होते हैं, जिन लोगों का वेट बहुत ज्यादा होता है, जिनको हाई ब्लड प्रेशर होता है, दे हैव इट वर्स. उनके लिए वेरिकोज वेन्स आर मोर ट्रबलिंग. सो टेक केयर ऑफ योर हेल्थ, वॉक, exercise and keep your weight under control. That will really help. And even if you do happen to get varicose veins, your treatment will be easier and more benefiting than if you are unfit. So fitness is very important. Early checkup and follow the treatment well, because ये प्रॉब्लम ना एक दिन में होता है, ना इसको सॉल्व करने में सिर्फ एक ऑपरेशन होता है. इसमें पेशेंट को भी थोड़ा बहुत अपना ख्याल रखना पड़ता है, जैसे कि कई बीमारी में होता है. इट्स नॉट यूनिक टू दिस. Diabetes, so many diseases, the patient is the main person who is important. Okay. And we always try to get this message across that you also have to contribute.
Right, absolutely.
I hope that answers your question.
Yes, absolutely, sir. So इसकी सर कोई specific age भी होती है जहां लोगों को पता चले या कोई symptom होते हैं ताकि people get aware about this? Excellent question. Very good, because most people look at varicose veins only की जो दिखती हैं नसें, which are visible, blue veins, thick, bulging, ugly veins. They think that is a problem. Right. Yes, that is a problem. But even without that, if you have swelling of your feet or darkened patches occurring on your skin, these can be signs of venous disease. Initially, you may see very tiny veins, which you call them spider veins. पतली पतली सी बिल्कुल नीली veins आती हैं. They can be early sign of varicose veins. Okay. Age-wise, I would say age and profession, etc. These can all matter. For example, pregnancy is a common point at which varicose veins develop, and that happens जो hormones होते हैं pregnancy के, और जो labor होता है of carrying the child inside for so long, उसकी वजह से varicose veins happen in lot of ladies during pregnancy. Only about 1 in 4 will still have varicose veins after delivery and 1 year. Okay. That 1 in 4 should seek treatment early, because if you wait,
it can have bad effect on skin and your own. So it is very insidious. धीरे धीरे क्या होता है, पेशेंट्स को कई बार खुजली होती है या लगता है कि बहुत थक गए हैं, tiredness by the end of the day, aching feeling in the legs. They say कि ये तो like उम्र के साथ हो रहा है, nothing to it. But sometimes it's not that. Sometimes it's the disease. So if you have itching, dark patches on skin, swelling of legs, or aching in legs if you stand or sit in the same position for some time. If you are in any of the professions which involve long periods of constant standing, for example, I see it very commonly in people, like particularly I had interacted with a lot of policemen about this, and they frequently face this problem. का काम ऐसा है, दिन भर खड़े रहना, very, very strenuous activity, or people who work in factories, things like this. If you're standing constantly, you're sitting in the same position, it's not good. Okay. Okay, so unko, if they have pain in the legs or any of these symptoms, they should get checked quickly. Okay. Right?
All right. So
that's the main thing.
Okay, one last question, sir. आप कोई message youngsters के लिए देना चाहेंगे, convey करना चाहेंगे, ताकि उनको भी awareness होना बहुत important है आज की generation में.
Yes. So if you, for youngsters, and when I say youngsters, I mean people who are much younger than me, obviously, and they sometimes see a few veins and they get scared. There is no reason to get scared. Is the first message I'd like to give them. Don't be afraid. It is not going to be life-threatening or anything like that, but get it checked up, firstly. Secondly, be active and don't become overweight. You should stay fit. Your work to stay fit in youth is going to help you when you become older, because staying fit is a constant lifelong thing. And if you see any bulging veins, any ugly veins, and you're worried about them, please consult a physician. Don't leave it. Though it may not be hurting you too much now, you need to know whether it is something which needs treatment now or not, right? Because if you wait, the problem may become much worse.
Absolutely right, sir. Thank you so much, sir, for sharing all the details with us. And I'm sure this is going to help everyone. जिसको भी होगा problem, I'm sure वो आपको आके definitely consult करेंगे और nearby clinics में भी जाएंगे. So, sir, it was lovely talking to you and having you on Big FM. So, thank you so much.
Thank you so much. My pleasure. It's been a pleasure being here.